water on you.
There you go. Our next speaker, Mary Spremulli, is a speech and language pathologist and nurse. She is founder of Voice Aerobics and author of Voice Aerobics Grand Slam, and Voice Aerobics Songbirds. These are voice and exercise programs. The Voice Aerobics is a family of products that blends the art and science of voice therapy into something fun to improve functioning and to reduce the speech and voice problems associated with Parkinson's disease. She has worked in the healthcare field for over 25 years and has lectured nationally and internationally on a variety of health-related topics. Ms. Spremulli has published in the area of clinical ethics and patients' education, and her blog has just been recently selected as one of the top 49 about Parkinson's disease. Please welcome Ms. Spremulli.
Thanks. So can you hear me? No. Can you? Not close enough? Yeah. Better? No? Oh, maybe just not turned up. Can you hear me? I can. Can you hear me now? Closer. Oops, how's that? Better? Better? All right, now, I used to do day-long seminars, 3 cities in 3 days, not on this topic, so to an audience of speech pathologists and nurses and so on. And at the end of the day, I'd get back to my hotel room very tired, and I would read the evaluations because I had to do that. And invariably, someone would write, the room was too hot, I couldn't hear the speaker, blah, blah, blah. So if anybody has a problem, raise your hand, okay? Don't write it on your evaluation. All right. So I have the challenging task of keeping you all awake after lunch when your stomachs are busy churning and taking blood from your brains. So because of that, in anticipation of that, I rearranged a little bit what I'm going to do this afternoon, and we are going to do some of Voice Aerobics together, and actually Jeff sort of started it for me because it's a little bit of what he was doing, but hopefully it will wake everyone up or keep you awake and help you participate and not just be listening. And usually, this is such a big room, I like to kind of mess with people, you know, especially guys that are like trying to nod off. So I may step down and, you know, come out there, I'll warn you. And I always like to ask first, how many people here, if you're comfortable sharing, who have a diagnosis of Parkinson's, have had a referral to a speech-language pathologist, either for speech or swallowing? So the typical small number, about 4%, 5%, and I'll comment on that later. All righty. So I'm going to play you just a little introduction from the Voice Aerobics DVD that just tells you a little bit of... Can't hear? No. Can't hear? Louder. Oh, yikes. Okay. Let's see. Okay. All right, I'll speak up. So.
I'm Mary Spremulli.
Can you hear that?
I've been a medical speech pathologist for over 25 years, and I developed a special interest in working with individuals who had changes in voice, speech, or swallowing as a result of Parkinson's and other neurological disorders. Frequently, when formal therapy ends, patients ask me for exercises that they can do on their own at home, and hence Voice Aerobics was born. In 1999, I began to offer a 50-minute exercise class that combined techniques from voice therapy and exercise physiology. This DVD is the express version of that class. Regular use of this program and others may increase your voice and physical functioning, and who knows, maybe people will even stop asking you to repeat.
Usually I ask how many people in the room think their spouse doesn't hear very well. How many of those people think that their spouse mumbles? So that's like the most common marital problem I've encountered throughout my career. All right, so you heard a little bit about what voice aerobics was. Just to reiterate, back in 1997, I was already working with people who had speech and voice and swallowing problems associated with Parkinson's, but I was beginning to see more folks. And so I began to develop a very strong interest. In 1997, I became certified in the Lee Silverman Voice Treatment Program, which some of you may have participated in. And in fact, at that time, I think it was the first time that they began to certify speech pathologists to deliver that program. And it occurred to me when I was providing that program, it's a pretty intensive voice treatment program, that if I did not give people ways to practice when they left therapy, the likelihood is they were not going to retain those improvements for very long. I can make anybody loud. If the mechanism is working, meaning if your instrument is working, I can probably make you loud in about 5 minutes. But can I keep you there? Can you keep yourself there? Probably not, unless you have actually strengthened the system. So that was really the impetus for me to develop voice aerobics. At the time, I worked at a hospital that had a wellness center, had an aerobics room, and I decided to create a live class at that time as an after-therapy class for my own patients who wanted to continue to work on strengthening their voice. Interestingly, I would put an ad in the paper every week, and lots of times singers would call me up, other people with other kinds of voice changes, wondering if the class would be of any benefit to them. Oops, I need to do that. So in 2008, that was in 1999, in 2008, I recorded a class on a DVD, which a few people got during the raffle. And that was, again, because patients were always asking me for the exercises. And so the goal there was to be able to create a program that people could follow easily on their own at home. In 2009, I created Grand Slam, which is a pack of playing cards. And on the face cards of those playing cards are some of the exercises from the voice aerobics program. And again, the impetus there was that I live in Southwest Florida. Many of my patients are older, don't want to be bothered with a computer or even a DVD player, but they were motivated to want to exercise, but needed a way to remember what to do. And so the playing cards were easy. They could slip them in their pocket, slip them in their purse, pull one out, and remember some of the exercise that they were instructed to do. And then in 2010, I recorded Voice Aerobics Songbirds, which is an audio CD. It's only 22 minutes long. It is designed to be fun voice practice on the go. A lot of my patients use it in the car, and we'll be doing a few things from that today. As time has gone on, I've also added and continuing to add other products, programs, and products that I have found in 30 years of practice to be a benefit to patients. And that includes the breather, which is on your left. It's a resistive respiratory muscle strength trainer, which I'll talk about a little later. And then an amplifier. And actually, I was using the amplifier for sound there. So voice aerobics incorporates principles from general exercise and voice therapy techniques that I had been using for years with other people who came to me with changes in voice. All of the exercises can be done standing or seated. We start seated and some come into standing, but you can do them either way. As you become more familiar with the program, you can add light weights or stretchy bands to make the exercise a little bit more challenging. And it's a guided program, so as you'll see when we do it together, it's as if you were coming to class with me, and that's what I tell my own patients when I give it to them as a part of their treatment program. When you pop it into your computer or your DVD player, it's as if you were coming to a class with me. So there's nothing to remember. And interestingly, that's one of the features about it, that a lot of my patients, even my patients that come to me with voice problems not related to Parkinson's, tell me that they like that they don't have to think about anything. I now have a private practice, and I do primarily home visits. And I often actually follow PT in, and we'll see pages of papers laying with some written exercises on the table. And just as I pull out exercises out of a magazine that I'm reading and I lay them on the table next to where I sit and watch TV, we don't often pick them up and actually do the exercises. And so I think for most of us, it's just easier if we're participating in a live class at a community center or rehab center, or if you have a guided program. So the voice aerobics class, the program, is a 3-part program. Part 1, the warm-up, focuses on posture and breath support and voice. So Jeff already grabbed 2 of those today, and I'm just adding voice. Part 2, which is about 32 minutes long, has a little bit more movement and a little bit louder voice. And then part 3 is a cool down. So in much the way an exercise class would be, where you start out kind of slow, get yourself heart rate and up to a more aerobic level, and then cool yourself down. As I created the class, my original goal was to create a voice strengthening program. But one of the other things I noticed when I was providing the Lee Silverman voice treatment program, which was usually in my office, is the primary cue for that program to get you to be louder is for you to think loud, to shout. That's a cue that you'll hear throughout the program. And while I understood how that might help someone and why it might help someone, it didn't always seem the best cue when we were sitting in an office at kind of a conversational distance. And so oftentimes my patients would turn to me and say, this doesn't feel normal, this doesn't feel natural, I was always soft-spoken. And they would kind of resist it. But when I took them into the aerobics room, and now we were being loud, and we were also coupling it with movement, it didn't seem so odd for people to have to generate more power in their voice. So as I added in movements, I tried to incorporate some of the guidelines for exercise for people with Parkinson's, which includes, and again, Jeff sort of commented on this, extensor movements, so stretching into extension to counteract a flexion, the gravity that's always trying to pull us down. Motor learning principles, which is just repetition and redundancy. It's how all of us learn best. It's also how our muscles learn. Sensory awareness training. I've been reading lately, seems like I keep reading articles about mindfulness. Meditation is considered mindfulness, where you're just sort of in the moment, not thinking about anything else. When I do part 1 of the program, which we'll do together, I find it relaxing and find that I'm usually in a place of sort of just paying attention to what my body's doing and not thinking about too many other things. And so I think that for many of my patients, and perhaps for you today as you do it with me, you'll also notice that it helps you just begin to notice your posture, how you're using your breath support, and how your breath support is supporting your voice, because the parts are all connected. Many years ago, really early in my career, I worked in pediatrics, and I became, at that time, certified in a particular treatment approach that I even was working with infants. And when you hold an infant in your hand, and me as a speech-language pathologist holding an infant in my hand that has some problems, I'm concerned about the coordination of respiration and voice, and I learned that if I moved them and handled them certain ways, I could actually cause them to vocalize more or differently. And for some reason, as we become adults, the parts become kind of disconnected, at least from the, I think, medical personnel who help to treat people. And so PT works on walking, speech works in an office somewhere on speech and voice, OT works on activities of daily living, and I think aren't always joined. And so it makes sense to me that if Jeff is working with a person on some dynamic movement, that he could incorporate voice and allow that person to actually have the opportunity to practice both at the same time. So as we do some of the stretching and some of the movements in the program, they are also designed to address some of the problems, again, that were talked about this morning, some of the stiffness that happens in muscles in the spine, in our trunk muscles, our respiratory muscles, some of the stiffness and changes that happen to the facial muscles. I don't think that's talked a lot about, but just as big muscles can become slower, stiffer, and smaller, and just as our voice can become softer, lower, our facial expression can also become flattened and more bland. And I'll talk about that again a little bit later this afternoon and why that's important. And throughout the component of the exercise that we're going to do together this afternoon, you'll hear me emphasize to exaggerate facial expression. That seems to be a little easier, I think, for women because we tend to animate more than men. I had a patient who came to me with a change in speech and voice from Parkinson's, and I was always on him about increasing facial expression, but he had worked for the CIA in his career, so he maintained that it wasn't going to happen. So I guess it would be like having someone who played professional poker. I'm not going to change their facial expression. All right. So we're going to now do part 1 of voice aerobics. It's 15 minutes long. I'm going to ask you to move your chairs away from the table so you have some freedom of movement. So that means to be able to kind of stretch your arms. If someone next to you was napping, wake them up. This is an active participation time. Okay, and you want to be facing this way just because, again, it'll be guided, so you'll be following along. And I'm going to come down there and sort of do it with you. But you can sit. Everybody can sit down. Yeah, so this is going to be done seated, but you just want to be able to move your arms and not hit anybody next to you. And just a few things I'll tell you ahead of time so that I don't interrupt it once it begins. The focus, remember, is on posture. Check yours. So if you can sit a little bit away from the back of the chair, already you're beginning to use your abdominal muscles, those core muscles, to support your posture. Your posture supports your breath supports your voice. There will be a sequence of breathing and voice, and the sequence will stay the same even as we begin to add some movements. And so the sequence will be, you'll hear me instruct you to take a deep breath, exhale through rounded lips, to exhale with a shh, like you were telling someone to be quiet, and to exhale with a humming sound. And that sequence will repeat itself even as we begin to add movements. Now, I've done this, watched this many, many times, and so I kind of forget that other people have never seen it before. And so there's a temptation to just be kind of watching it like a movie. And even when I give the DVD to my own patients, I remind them, especially the guys, this is not subliminal. Like, you can't just put it in the DVD and then go to sleep for an hour and hope that you'll wake up talking better. You actually have to do it. If it feels confusing to you about what the arms are doing, then just focus on posture. Check yours. Breath support and voice. All right? And I'll come down and do it with you. And I'm sorry, the people in the front, the amp might be a little loud, but I just want to make sure it projects to the back. Okay?
All right, everybody. So we're going to begin first by working on posture and breath, and then we'll add our voice. But our posture and breath always is a support for our voice. And the first thing we're going to do is just feel what it feels like to take good diaphragmatic breaths. And so you may even want to start with one hand on your abdomen, because you're going to feel your abdominal muscles relax when you take the breath in. and contract when you let the breath out. And they really are the working muscles for respiration and for voice. Let them do the work. Keep your neck and shoulder muscles relaxed. We're going to take a breath in through your nose and mouth and exhale through rounded lips.
Round your lips. Don't do it half-heartedly.
Blow, blow, blow. Release the breath. And when you're at the end of the breath stream, your abdominal muscles should feel tight. You really want to round your lips. That's called pursed lip breathing. It's a real effective way to exercise. You don't want to just half-heartedly do that. And you want to begin now, even with the breath work, to do what might feel like exaggerated facial movements, because we really want to counter one of the effects that Parkinson's can have, which can kind of rob you of some of that facial expression. All right, let's do another one. Take a deep breath in through your nose and mouth. Exhale through rounded lips. That's 2. The breath out is always about double the breath in, and the breath out is also the breath that we're going to speak on. So this time, as you exhale, you're going to exhale with a shh, like you were telling someone to be quiet. So you're going to actually be able to hear that breath stream. Take a deep breath in through your nose and mouth. Exhale with a shh.
Abs should be tight at the end of the breath stream, not your neck and shoulder muscles.
One more time with a shh. Inhale through your nose and mouth. Exhale. Let those abs work. Tighten those waist muscles. And then one more time, and this time when you exhale, we're going to turn our voice on, but we're going to turn it on with a real nasal resonant sound. So we're just going to hum. Inhale, exhale with a hum. You might even feel some vibration up here in your face and in your nose. That's where we want your voice to be resonating. Great. We're going to continue to focus on the breath. We're going to continue to focus on posture. Check yours. Make sure that you're using your abs to help you sit up straight in the chair. And now we're going to add your arms. So we're going to inhale and exhale through pursed lips, but this time, as we inhale, our arms are going to come up chest level and exhale to the side. Ready? Begin. Inhale up.
Just come shoulder level.
Exhale to the side.
Round your lips and blow the breath out. Your abdominal muscles are supporting the breath.
Any higher than your shoulders, but you're going to hold that stretch, breathe naturally, and gently release your arms to the side.
If you have shoulder problems, you come as high as you can.
Arms come to the side. Inhale, arms come up chest level. Exhale to the side. Round those lips like you were giving a kiss. And hold the stretch. You're going to look beautiful tonight. And release your arms. We're going to inhale with our right arm coming up over our head, and we're going to exhale with a shh. Inhale, your right arm comes up. Really stretch those muscles all the way down the length of your body. Exhale with a and as you're exhaling, your abdominal muscles are supporting your breath. They will support your voice. We're going to inhale, and left arm's going to come up over your head. As you inhale, exhale with a big shh. Great. And one last time, we're going to clasp our hands together. We're going to inhale, our arms are going to come up over our head. We're going to exhale just with a humming sound. Feel that resonant voice again. Inhale, up, big stretch. Exhale down. Good. Check your posture. And we're going to do some head rolls. We're going to start as we inhale and exhale through rounded lips. We're going to look over your right shoulder and hold that stretch. So inhale, exhale to the right.
Round your lips, blow the breath out. Nothing should hurt.
Great.
Go as
Now
far as you
breathe
can.
naturally, but hold that stretch. Look even a little further if you can, like you were backing out of the driveway, if you're still driving, pulling out of a parking spot. Now gently roll your head back across your chest. Hold it just for a few seconds down. Let those neck muscles in the back stretch. And then gently bring your head up. Great. We're going going to do 2 more. The next time as you exhale, you're going to hear the airstream because you're going to exhale at the end with a shh. Inhale through your nose and mouth. Exhale to the right. Hold that stretch. Look a little further. Breathe naturally. Check your posture. Roll your head back down across your chest. Hold it for a second. Let those back of your neck muscles relax and stretch. And bring your head up to the middle. Nothing should ever hurt. Do everything to the extent that your body will allow you to. We're going to turn one more time to the right. This time, we're going to just exhale with a humming sound. We're going to hear that resonant sound again. Inhale. Exhale.